Over the last few weeks, we're seeing an increase in COVID cases, driven by community spread. New cases are increasing sharply, not only in the region, but also statewide. As is percent of positivity is also increasing statewide, but especially here in Northeast Louisiana. This is concerning because we've been here before, where we've been at 13.6% when the governor issued his mask mandate. And then we saw that positivity rate decrease to 6.5% by mid-September. Since we've gone into phase 3, there has been a steady increase, and now we're at 15%, which leads the state. This increase, tragically, was followed by an increase also in hospitalizations.
The number of patients that are requiring hospitalization are increasing statewide, and of course we are seeing that here in Northeast Louisiana too. The largest challenge for hospitals right now seems to lie on capacity and having enough room for patients as they come in through the emergency room, or they're transferred from other smaller outlying hospitals into the bigger hospitals in Northeast Louisiana. The issue is not all supplies, and the issue is not all bed capacity. It actually this time seems to be more around staffing.
Every hospital in Louisiana across the country is concerned as we enter the winter months. Typically flu season starts in November or December. Last year we were really full in the hospital, but we were full because of people with flu that got a secondary pneumonia. And so certainly we're concerned that with the continued pandemic and with us having the third wave now hit and Thanksgiving holidays where we feel like there'll be some significant spread, that if we also have a significant flu season this year, that hospitals are really going to be stretched then.
There clearly is more COVID-19 out in the community right now. That's very important that you take precautions when you're out in the public, when you're doing your grocery shopping, when you're out in the community. Be careful, wear your mask, socially distance, do your hand washing as often as possible, and that will help prevent you coming down with this virus and possibly passing it off to a loved one who might have significant comorbid conditions to put them at risk for some of the severe consequences of this virus.
It's frightening to see what the numbers are doing, but one thing I try to realize is that we see all these graphs and numbers. They represent people in our community, and these are families that are dealing with this, and we're just, like I said, I think like most people, we're just all disappointed to see where the numbers are going, but again, I think it's a time to re-energize where we're, our thoughts on how to mitigate the spread of this.
And it's been a long time now, where I think we're at 9 months now, and it's just hard. Everyone's tired. Everyone's tired of wearing the mask. You're tired of not seeing your family and maybe not being able to do things that we're used to being able to do. But there is an end to this, so we just really have to be careful. The fatigue is hard on everybody.
Christmas is a very odd time for many of us in terms of we traditionally get together with families, etc. We are not having any gatherings in terms of a hospital. We're also encouraging our employees and families not to do so, and to also exercise precautions like masking as well as social distancing. There again, we have a responsibility and an opportunity to reverse this trend of spread of COVID-19.
Since the onset of COVID-19 in March, our staff has stepped up tremendously. My staff continues to sacrifice a lot to make sure that they're caring for patients. Because they're exposing themselves to positive patients, they are also having to separate themselves from family members and loved ones whenever they go home. And that has a tremendous impact on staff. And despite those challenges, the staff continues to step up and continues to volunteer to care for these patients.
Our doctors and nurses and the entire team here that are the frontline healthcare workers amaze me every single day. They put themselves in harm's way to take care of the sickest patients, and they come in with pride. They're tired. They really are tired. They're working extra shifts. They're working in quarantine units. They are sometimes avoiding contact with their own family members to reduce the risk of transmission to their loved ones. But after 9 months, they continue to do it. They are doing it with joy, and They know that they're making a difference in this world, and it's amazing to see the love, the passion, and the compassion that our team members have for our community.
Northeast Louisiana.
Northeast Louisiana.
Let's work together
Let's work together
to stop the spread.
To stop the spread
Of COVID-19.